The surge in novel coronavirus cases in Jamaica has many worried that there will not be enough beds for those who will require hospitalization. A request for a temporary hospital reportedly came from Chief of Defense Staff of the Jamaica Defense Force, Lieutenant General Rocky Ricardo Meade. The U.S. Southern Command, using humanitarian funds, purchased and donated to Jamaica a large mobile field hospital for COVID-19 patients. We have more in this report.
Would recognize that
recently, Jamaica's Minister of Health announced community spread of the coronavirus COVID-19,
which is a phase of the virus that means more persons have the virus. As a consequence, more are susceptible to getting the virus. And the response that is required as a result of this means more infrastructure. And so the facility here has come at the right time, even though ideally we would prefer no one uses it.
The hospital was transported into Jamaica on a U.S. Air Force 17 Globemaster III last weekend from South Carolina. Jamaica has a 350 COVID-19 bed capacity. Approximately a third, or 119, of the designated COVID-19 beds are currently in use by individuals with COVID-19. 7 of that number are said to be in critical condition. The 70-bed field hospital, valued at over $750,000 US, has been erected at the National Chest Hospital in Kingston.
This field hospital will provide the additional infrastructure to treat up to 90 patients at a time. It's configurable, it can be moved, it comes with training, and it comes with a warranty, and it comes as an example of the friendship of the United States of America. I know that together we're going to fight through this virus, and we will be better, and we'll be better prepared for the future. It's unmasked. COVID has unmasked security threats in our region, but has also importantly demonstrated our commitment and our humanity to work together.
When the current crisis has passed, the hospital will remain as a vital tool for the government of Jamaica to respond to any future public health emergencies or national disaster, whether here in Jamaica or throughout the Caribbean. The United States Agency for International Development and Center of Disease Control and Prevention has committed over $3 million worth of equipment, supplies, and financial support to help Jamaica during this pandemic.
In addition to this facility, as previously announced, we will open 3 more field hospitals across the island that will see a total of just over 150 additional bed capacity being deployed for the use, if required, of COVID-19 patients. We've also done much work in improving our critical care capacity and our hospital management. We now have some 27 high dependency beds in place with ventilators, 19 ICU beds up from 8, and some 348 isolation beds up from 15. We have also increased our non-invasive ventilator support by increasing the availability of high-flow nasal oxygen in more hospitals across the island. Our work is not done. We are always assessing and always adding capacity. And critical to the equipment and the infrastructure, such as the one here, are the people to man it. And so part of the response is to expand and to collaborate where we can, the healthcare workers. And I will say here now that we do have the personnel to man the facility, and so the facility will be ready for use as required.
The official handover of the field hospital took place on Thursday, September 24. The modular or field hospital is equipped to operate independently. It has 2 diesel generators and 8 air conditioning units.
Each one of these beds is capable of holding a person up to 350 pounds. And the hospital comes with there's generators, 2 generators that's hitched onto trailers. There's HVAC, heating, ventilation, air conditioning. There's 8 of those. And there's the HEPA, as well as what JJ is gonna go into the technical aspect of here soon. And as well as 2 toilets, 2 showers, 4 sinks.
For the news on PBCJ, I'm Marlon Samuels.